I'm Dr. Clint Sexton, and this is Lisa Sexton. And today we want to find out if you are like us. So what does that mean when I say something like that? What I mean is, how do you view health? We view health, we have two major divisions when we're talking about it. You have health that can deteriorate into disease, and then at which point you're trying to cure and manage disease. And on the other side, you have prevention and preventing disease. And that's what we believe, and that's what we work on in our office here using functional medicine. We believe that preventing diseases and illness is a better strategy for everyone involved instead of waiting till you have a disease and then trying to manage that in the medical model.
Right, and so a lot of our motivation actually comes, it's very personal for us because each of us have issues in our family as far as genetics and as far as disease that motivated us a long time ago to start our path. For instance, my side of the family, I have a lot of digestive issues. There's Crohn's disease, there's cancer. Almost every woman in my family has had some sort of cancer, obesity, etc. And as a young person, I was very sick starting out before the age of 20. And I looked back and I thought, this isn't going so well for people. And so I decided to try something a little bit different, and I started changing my lifestyle at that point. So I've been at this for about 30 years, and now I don't have any of the things that everybody else in my family has. I totally healed my guts. I totally took care of the allergies that I had and all the other digestive issues that I had, but I live it. And so part of why I do what I do is because I walk my truth, and I see the difference between the two sides.
Right, and she's been able to avoid these diseases, and we're very happy that she's the only female so far that has not had cancer in her family. So you talk about genetics, you talk about your susceptibility, but it still comes back to lifestyle. So really when we're talking about functional medicine, it's functional medicine combined with lifestyle medicine because, Lisa made these changes. She doesn't have these problems. She doesn't require medication. She doesn't have any of these diseases. In my family, it's a different situation. In my family, we're prone to more of along the lines of heart disease, diabetes, and obesity. Most of the men in my family are taking medication for blood pressure issues, and half my family is overweight, and they have their issues and they're taking medications, and I don't have any of those health issues and I don't take any medications, and we're from the same gene pool. So the point is, what you do, the choices you make matter. They make a difference. And so we want to speak to people that believe what we believe, that the choices you make, the foods you eat, the way you live your life is going to have an impact on your health. And I just wanted to talk about a few statistics here, because this is just us talking about our opinion.
And living our life.
And living our life, yes.
For 30
and
years.
So I have some information here. This is from the CDC. So this is from the Centers of Disease Control and Prevention, okay? And we look at the leading causes of death, of what's happening right now. And in that group of the top 10 leading causes of death, you have heart disease and cancer as number 1 and number 2. You also have stroke, Alzheimer's disease, and diabetes, okay? These are preventable conditions that we're talking about here. Cardiovascular disease is still the number 1 killer. 1 in 4 people is going to die from cardiovascular disease. Now, we thought that we had all this handled when we started using cholesterol medication and statins. Well, statins came on the market, flooded the market, back in 1987. So that was 32 years ago, okay? Yet it's still the number 1 cause of mortality, the number 1 cause of death. So obviously, this is not a good solution. There's also statistics here that, from the CDC talking about, I'm going to go back 1 point here. I'm going to go back to the heart disease. And this is what the CDC says about heart disease. Here are your risk factors. Diabetes, so your blood sugar, being overweight, poor diet. Imagine that. Not having enough physical activity, and then excessive use of alcohol. So we have a lot of, these are just the basics. These are the fundamentals. We go so much more deeper into this when we're dealing with chronic illnesses here in the office. So then cancer, and this is from the CDC, the number of new cases and deaths is going up. So contrary to what we've been led to believe, we're not winning the battle on heart disease, and we're not winning the battle on cancer, and we're not winning the battle on diabetes or any other of these other chronic illnesses. These are the things that are killing us. Okay, now one more thing. Sorry. I want to show my graph real quick.
We're very excited.
So, and this is from the CDC showing a graph. I don't know if you can see this, but this is the line going up, showing that the incidence of cancer and death from cancer is going up. we're not winning. Yet we're looking for cures. We want cures for everything. We don't have cures for diabetes. We don't have cures for heart disease. We don't have cures for dementia. We have nothing for dementia, by the way. And these are all chronic illnesses that are preventable. So this is how we look at healthcare. We're losing these battles. These are the things that people are dying from, and these go back to lifestyle. Okay, lifestyle, and finding and identifying your risk factors long before you have the disease. Does it make more sense to try to manage and clean up the mess after the fact, or prevent it from happening in the first place?
Exactly. And that's really the most frustrating part of this is a lot of it is actually common sense, and those factors that you said, like exercise and maybe drink a little less, or maybe just really know exactly what foods you should and shouldn't have. Everything is preventable on that case, and yet all of these diseases are going up. We're using more and more medications, and we don't have to. So that's why we started this with, are you like us? Are you
Right.
looking at this like, wait, this isn't working, what will work? And within our clinic, we actually can help with that. You don't have to figure it out on your own. We have a system. We look at labs, diagnostics. We help you specifically with what you have. That's what we do with our life, and every single day we live what we talk.
Exactly. One more thing I want to put in. And if you still think that medicine is going to save you, when I say medicine, I mean the pharmaceutical industry, okay? This is also from the CDC. And they're now seeing that we are no longer living longer, okay? It says here that 3 data briefs published by the CDC late last month show that for the second time in 3 years, the average life expectancy in the United States has actually gone down, okay? And the latest CDC data shows that the U.S. life expectancy has declined over the past few years. This is from CDC Director Robert Redfield, MD. Okay, so.
Okay, that, if you want to take a screenshot, is a big deal.
Right. So we're not projected to live longer. We're going to spend a lot more in healthcare, and it's just going to get more and more expensive, and it's becoming less and less effective. And the answer is preventing it before it starts. So
Right.
That's what we're about. We want to know if you're like us. If you're like us and you'd like some help, contact us. We're here for you.
We'll help you out. That's what we do.
All right. Thank you.